It's always a little surprising that a lot of people know a stroke is something they don't want to have, but they don't really understand what it is. A stroke, as the term implies, is when you're stricken. It's sudden and unanticipated. A stroke, in its simplest terms, is a damage to the brain that occurs from circulation issues. There really are two kinds of strokes. There are strokes where there's a lack of blood flow to the brain caused by a blockage, and that's about 80% of strokes are that type. And then there's about 20% where there's a breakage in a blood vessel and causing bleeding into the brain. Those tend to be the more serious kinds of strokes.
There are two types of strokes. The first type of stroke is ischemic. Ischemic strokes occur when oxygen doesn't get to the brain tissue. Usually that's as a result of a blockage in the vessel that can be caused by a blood clot or a plaque that breaks off and travels. Another type of stroke is hemorrhagic. That's a bleed. The bleed occurs primarily as a result of high blood pressure. That's the number one cause. It can be caused by other mechanisms as well.
Strokes are a relatively common occurrence. They are the fifth leading cause of death in the world, but they're the most common cause of disability. A lot of patients are a lot more worried about having something that's going to leave them disabled for the rest of their life as opposed to something that's just going to kill them. So, a lot of people would rather have a heart attack where they're going to drop dead and that's going to be it, as opposed to something where they may survive but be severely debilitated for the rest of their life. There are about 700,000 people in the United States who have suffered a stroke at some time.
When someone is having a stroke, they will oftentimes experience symptoms such as slurred speech, weakness on one side of the body, visual changes, confusion. There are many, many different ways a stroke can present. Some of them very, very pronounced, some of them much more subtle. Oftentimes we use an acronym called FAST to help people recognize stroke symptoms. And the FAST stands for F for face, which would be facial droop. The A is for arms, meaning arm weakness, but it also can be arm or leg weakness. The S is for speech. Speech can be slurred, or speech can be actually absent, or just altered in some way. And the T is for time, and time, we say time is brain. Time is of the essence in terms of getting to the hospital immediately.
If you're concerned that you or a loved one might be having a stroke, the sooner you get to the hospital, the better. So you need to call 911 and get there as quickly as possible. Before 1995, there really was no specific treatment when someone had a stroke, so a delay of an hour or even a day probably didn't make that much difference. But we now have treatments that, if initiated early, can make a significant difference in the outcome. So it's important to get to the emergency department on an urgent basis. It may make the difference between having an effective treatment and not having an effective treatment.
If you're thinking that you're having a stroke, you should come immediately to the hospital. One of the first things that will happen when you come to the emergency room is that you'll get a CAT scan, or sometimes called CT. That is what determines whether it is a bleed or an ischemic stroke. You do not diagnose a stroke with CT. You only rule out whether it's a bleed or an ischemic stroke. For definitive diagnosis, you need to have an MRI. But on the initial presentation at the ED, you would get a CAT scan immediately.
Once somebody has a stroke, if they get to an emergency department quickly, there may be some treatments available that will reverse the damage that's being done. If you're dealing with a stroke where there's a blockage and a lack of blood flow to certain brain areas, if you can reestablish that blood flow, the damage may be averted. There are several ways that that can occur. We can give medication in the vein that dissolves the blood clot and reestablishes circulation, or in certain situations, the clot can be removed by a doctor who's trained to do that sort of interventional procedure. All of those treatments have to be initiated early. They're not something that can be done a day or 2 days after a stroke happens, and some of them can only be given within 3 hours of symptom onset. So to have those treatments available, you need to be in an emergency department. Once somebody is having stroke symptoms and there's a lack of blood flow to the brain, if they were to get to a facility where the circulation can be reestablished, there may be things to reverse and prevent damage. When someone has a stroke, the brain is damaged by definition. We can see it on our imaging, and one can anticipate the patient will have continued symptoms, as opposed to a transient ischemic attack or a TIA where the circulation is reestablished and no damage is done. The brain requires oxygen and blood flow, and if it's deprived of that, the brain will be damaged. The damage could be extensive, in which case the patient has a severe stroke, or there could be just a small amount of damage, and the symptoms may be fairly minimal. The type of symptoms a patient experiences depends on what part of the brain is deprived of blood flow. So that explains why the symptoms from a stroke can be quite variable depending on what area of the brain is damaged. Once somebody has had a stroke, they may very well have difficulty with their movements. They may have weakness in an arm or a leg. They may have loss of sensation or numbness. They may have slurring of speech or have significant language impairment. They may have trouble walking or with balance. They could have other less common symptoms such as balance issues, dizziness or vertigo, double vision. So there are a large number of different types of symptoms that could occur. Typically, when someone has a stroke, the symptoms are the worst when the stroke occurs and then gradually improve over a period of time. Some people recover to a large extent or almost completely. Some people may be left with significant continued symptoms because the brain damage is extensive. Once a person has had a stroke and the brain is damaged, there are ways to try to improve the patient's functioning. We typically will refer a patient for physical and occupational and speech therapy. That doesn't repair the damage that's been done, but it helps reprogram the brain so that other areas can take over and compensate for the area of damage. We know that following a stroke, it's possible for new brain connections to develop and help compensate. And of course, other areas of the brain that are not damaged are able to take over to some extent. The ability to recover depends on a lot of factors. It depends on the area of the brain that was damaged. It depends on how extensive the damage is. We know that the younger brain is much more able to recover from a stroke than an older person. When children have strokes, for example, their brains are remarkably able to recover. And it also depends on the health of the brain. If somebody's already had several strokes in the past or has some other brain problem, they're going to be less able to recover. The main concern after someone has had a stroke is that we do everything possible to prevent another stroke. And that's what we refer to as secondary stroke prevention. After someone has had a stroke, they will likely be on some sort of medication that thins the blood. If it's a kind of stroke that's associated with decreased blood flow, this could be aspirin or some other medication or anticoagulant or blood thinner. It's important that they see their doctor regularly about having their blood pressure monitored and treated. They often will be on a cholesterol medication. Things like weight reduction and regular physical activity and control of diabetes are all important factors. If someone is a cigarette smoker, they need to stop smoking. So most of the emphasis when someone has had a stroke is on those measures that will help prevent any additional strokes or damage from occurring down the road.
Some of the risk factors that could lead to stroke are hypertension, which is probably number one, family history, smoking, and diet, especially with sodium. The most important thing to consider if someone is having a stroke is to get to the hospital quickly. Most people that are having stroke don't recognize it in themselves. It's the bystanders or their family that recognize the symptoms. And when they recommend that you should go, you should go.